Welcome. I'm Saad Dino, pharmacist and co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug and Newton. I would like to welcome everyone back to our show, A Healthier You. Our goal is to discuss current health topics and to provide information that will guide you to a healthier lifestyle. Today, we will be discussing addiction with Karen Hurwitz, the manager of clinical pharmacy services at Inman Pharmacy in Cambridge. Karen is also the chairperson of the Massachusetts Pharmacists Association. She earned her Doctor of Pharmacy degree from Northeastern University's Bouvier College of Health and Sciences in 2006 and became a board-certified pharmacotherapy specialist in 2009. First, I want to welcome and thank you, Karen, for being here today. I want to discuss addiction. This topic is very important to us as pharmacists. It has affected so many families in the past years, and like I said, especially here in Massachusetts. Could you start talking about yourself and your role at Inman Pharmacy, please?
Sure.
Welcome here.
Thank you so much, Saad, for having me. I really appreciate this opportunity.
Sure.
So I've been a pharmacist at Inman Pharmacy for the last 10 years. There, I am the manager of clinical pharmacy services, and basically I am in charge of the immunization program that we run and the medication therapy management program that we run, which involves doing comprehensive medication reviews for predominantly our elderly patients enrolled in Medicare program.
Sure.
We are also currently involved as a study site for the MOON study out of BMC, which is the Maximizing Opioid Safety with Naloxone study. So we have a standing order for naloxone, better known as Narcan, in the public, and we are encouraging patients and community members to come in and get the Narcan kits.
Awesome. I mean, I've known you for many years, and you're a colleague of mine as a pharmacist, and I know you've done tons of work, and bless you for doing that with the opioids. Mm-hmm. What got you into that, if I may ask?
So in 2012, I was closing the pharmacy, and I was held up at gunpoint.
Wow.
And one of the things that it really threw me for a loop, and it was definitely a life-changing experience for me. And what I wanted to do, once I sort of got my feet back under me, was to basically reduce people's wanting to do those types of activities and reduce opioid abuse to begin with. Because if there isn't a demand for it, then things like that are less likely to happen.
I'm sorry you went through that.
Thank you.
That can't be easy.
It was not.
But man, you picked it up here and helping so many people with this program that you're kind of taking on. For our audience, can you define addiction, please? And what type of drugs can people become addicted to?
Sure. So I'm going to start with the types of drugs. There are prescription opioids that you can obtain with a prescription from a prescriber. So things like oxycodone, morphine, codeine, fentanyl, things like that. And then there are illicit substances, things like heroin that you would get on the street, and the fentanyl derivatives like sufentanil and carfentanil, which are the dangerous substances that the heroin supply in Massachusetts and in several other states has been laced with. Addiction is a chronic and relapsing disease that affects your brain's ability to process reward and motivation. And so when an individual becomes addicted to a substance, whether it be oxycodone or heroin, they develop a tolerance and they require more drug to achieve the euphoric feeling that they have. In addition, they are also trying to prevent withdrawal symptoms, which are very unpleasant. And so what happens as addiction sort of progresses is the brain chemistry changes. And while you need more drug, your body is also more susceptible and more keen on picking up cues and triggers from your surroundings. And so one of the reasons that it's relapsing is once you become addicted, it's very difficult to abstain for the reasons that we already sort of mentioned. If you do abstain, whether it's with treatment or incarceration, if you go back into the same habits that you had prior to abstaining, then you fall into the same sort of cycle. And these individuals will not recognize that they're doing harm to themselves or harm to their personal relationships. They will do things that they ordinarily would not do. They'll steal from family members. They'll commit crimes. And they unfortunately they spend the majority of their time trying to obtain more drug to prevent withdrawal, and the cycle sort of continues.
It's that vicious cycle that we always hear about. You and I as pharmacists always have dealt with that matter. And so you hit on the medications that are and the illicit and prescribed. So I've heard it over and over again. You start with an oxycodone, or you go to the dentist and you have a tooth extracted and they prescribe something to you, and all of a sudden, several months later or a couple of years later, you're doing heroin. Mm-hmm. What leads to that?
So because you become addicted to the substance, and because you need more, you develop tolerance and you need more drug, there are a couple of reasons that people may transition to heroin. If they had been getting a prescription opioid like you described, usually those are prescribed for an acute issue. And once the acute issue is resolved, you would hope that the medication is no longer present. That doesn't always happen. And what we find is eventually either the prescriber catches on that there's a problem, and they cut off the supply. So they say, I'm not going to write this prescription anymore. Or the pharmacist says, I don't really feel comfortable filling this prescription anymore. Or in other instances, individuals may not even have a prescription. They may be getting that supply from a friend or a family member. And maybe that friend or family member can't get it anymore, or doesn't have a reason for it anymore, or recognizes there's a problem and says, you know what, I don't want to participate in this anymore. And so they still have that need for the substance. And heroin is plentiful,
unfortunately,
and cheap, and provides a substitute.
Thank you for that answer, because that's what we're hearing now in the news, and I know our state government and federal government are studying this opioid crisis tremendously. Mm-hmm. For our audience and family members that might say, well, how do I know my loved ones, whether a friend or a family member, husband, wife, kids, how could they recognize that somebody's using illegal drugs?
So there are a number of warning signs that you can watch out for. Number one, if the person starts to withdraw from you or from their friends and sort of isolates themselves, because usually this is not something that you advertise to your friends or family. So usually these individuals are doing this in secret because of the stigma associated with it, and because when they first start, they know that this is not something that's good for them. Okay. And then as things progress, they sort of lose sight of that. So isolation. At the same time, they may be starting to hang around with individuals that they normally wouldn't hang around with. So other bad influences to reinforce and encourage their continued use. These individuals also tend to have financial trouble. Because of the way addiction sort of progresses, and they spend more time either trying to get the drug or use the drug, that doesn't leave a lot of time for friends and family, so the isolation. It also doesn't leave a lot of time for work and other obligations, and so they may be missing a lot of work or missing family gatherings or things of that nature. So that can become problematic. And if they're missing work, they're also missing a revenue stream. And so if you have someone who is starting to borrow a lot of money or spend money that, excuse me, it doesn't seem that they have, and they don't have a lot to show for the money that has been borrowed. They haven't bought anything extravagant or anything like that. That could be a warning sign.
Got it.
You can also look for signs of tolerance. So if someone is prescribed an opioid, or for your audience, if you're a parent and you are taking a chronic opioid, or a grandparent and you're taking something chronically, you want to make sure that you keep that in a safe place and out of the reach of people that shouldn't have it. Because one of the things that we start to look for is early either refills of medication or requesting early new prescriptions. So if the supply is dwindling and the person is using more than they should, whether it's the person who it's prescribed for or someone who's diverting it, that's something else to sort of watch out for. And then withdrawal signs and symptoms. So if someone is overly agitated, is sweaty, is constantly complaining of muscle aches and pains, is anxious, seems really depressed, those are all things to sort of watch out for.
Okay.
And then finally, in addition to missing work and things like that, if you're school-age children, you will probably see a rapid decline in grades. Or participation in after-school activities that they may have enjoyed doing in the past.
The heroin that I studied maybe in school or know about from 10, 15, 20 years ago is not the heroin of today.
Yeah.
So can you discuss that a little bit for our audience to understand why you and I and all the medical professionals and state officials and federal officials are so concerned about the heroin of today?
Sure. So the heroin of today is not just heroin anymore. It's heroin laced with fentanyl derivatives.
Okay.
And to give you some perspective,
please.
Heroin is 2 to 3 times more potent than morphine.
Can you say that one more time for our audience?
Sure. Heroin is 2 to 3 times more potent than morphine.
Okay.
Okay. Fentanyl is more potent than heroin.
Yep.
Carfentanil, which is a derivative of fentanyl that's being so the fentanyl that I'm talking about that's being laced in heroin is not the FDA prescription grade fentanyl that is made in certified labs.
Yep.
This is fentanyl and fentanyl derivatives that are made in secret underground labs that do not have the capacity to measure small amounts, small quantities. And that's important to note because carfentanil, which has surfaced recently in the heroin supply in Massachusetts and in New York and likely elsewhere, is used as a horse tranquilizer, and it is 10,000 times more potent than morphine. Okay. So that means you need a much smaller amount to overdose and to die. And the way that opioids cause overdose is, in addition to reducing pain and providing some level of euphoria if you take enough, it also suppresses the breathing center in your brain.
Yep.
And so what happens is the more drug you take, and with carfentanil, it's a very minuscule amount, it basically slows your breathing until you stop breathing altogether. And the problem with this is individuals get their supply of heroin from whomever they get it from, from their dealer.
Yep.
And by looking at the powder, you cannot tell if it's heroin or if it's carfentanil. And the labs they're using can't really tell that they're using too much.
Yep.
And if you use the dose of heroin that you're used to using and it has carfentanil in it, chances are you're going to experience an overdose and you are likely going to die as a result of that.
Thank you so much. I mean, that's just such important information that our audience needs to hear because, again, the heroin of today is not the heroin of yesterday.
Not at all.
And it's so much substantially more dangerous. It's causing all these overdoses, death, not just in Massachusetts but across the country.
Mm-hmm.
So thank you so much for being so elaborate on that point because it's so important. Um, to piggyback on that, why is it so hard for sometimes it's difficult for people to get the help they need? We hear that once, all the time. Is it that the individual doesn't want to get the help, or is there parameters, or is there like walls that are not getting the help, getting them the help they need?
I think it's multifactorial. I
Okay.
think that there's some level of if the individual isn't ready,
Okay.
then that's going to be a barrier.
Absolutely.
Because of the disease itself,
Yep.
as it progresses, they become less aware of their own self-care and they become less aware of their own self-harm. And as a result, they also become more isolated, and so they push family and friends who care about them away. They may not be entirely honest with their providers who are trying to help them. And so they isolate themselves. There's a level of denial. And then there's also barriers to getting into treatment. Not all insurances cover long-term treatment facilities, which are necessary.
Yep.
As I mentioned earlier, this is a chronic disease and it's a relapsing disease. And oftentimes it takes multiple quit attempts before an individual is in recovery mode.
Yep. And there has been a lot of success stories.
Yes.
I mean, I know a lot of individuals that, just from the medical field
Mm-hmm.
that had successful treatments.
Yes.
And been now sober and clean for a long time. So there is an avenue to get cleaned.
There is.
If you want it.
Mm-hmm.
I think that's the important message that we need to get to our audience.
And people also need to know where to go
Exactly.
to get help. So the first step
Yep.
is identifying that there's a problem.
Yep.
And the next step is identifying what avenue to go down next. Usually I would recommend their prescriber.
Okay.
Now, if, a lot of times because these individuals aren't really taking good care of themselves, they may not have a provider. And if that's the case, there's a 1-800 number on Department of Public Health
Yep.
where people can call and get help and get access to treatment.
Awesome.
And it's 1-800-327-5050. They are open Monday through Friday, 8 a.m. to 10 p.m., and Saturday and Sunday from 9 a.m. to 5 p.m. They have counselors on call.
Can you say that phone number one more time?
Absolutely. It's 1-800-327-5050.
Thank you so much. And that was going to be my next question. Is what are some strategies for getting help? Obviously, that's one strategy. The prescriber is another strategy. I know there's a lot of centers that are opening
Mm-hmm.
because of the crisis to help those individuals that have this disease, as we call it, which is addiction. So there are many avenues that these individuals that need help can get help.
Yes.
And thank you for sharing that.
And there are also support groups that family members can also join to have conversations with other families that are undergoing the same crisis.
Okay.
Learn to Cope is a good place to start.
Okay.
So I think it's learntocope.org is
And
the
that's
website.
There's many local groups.
They have local
Awesome.
Groups on
Okay.
there that you can search. Yes.
Thank you so much. So nowadays in the news we hear of it again, the addiction issue, and sometimes like individuals get addicted that you'll never expect to be addicted to such opioids or heroin or other illicit drugs. Can you explain what people could, what patients or customers or viewers, individuals could do to prevent them from getting addicted to such drugs?
So if you attack it from the avenue of starting with a prescription opioid and then
Yep.
transitioning to heroin, number one, you need to make sure that you're following up with your doctor if you have an acute issue and you're prescribed an opioid. You want to take the lowest possible dose for the shortest period of time. There have actually been recent studies to suggest that if you take an opioid for longer than 3 days, your likelihood of being on that opioid a year later is much higher than if you didn't take it for that long.
3 days.
3 days.
Wow.
There is an
Okay.
impact at 3 days.
Okay.
So if you don't need to take it, don't take it. try using Tylenol or over-the-counter ibuprofen or prescription-strength ibuprofen or prescription NSAIDs. So start with that. If you are, you do have an acute need, but it's a little bit longer than, let's say a week or so, you should be following up with your prescriber. And you should be checking in with them and making sure that when you're taking that medication, you're taking it because you're in pain and not because you're experiencing any withdrawal symptoms or because you like the way the medication makes you feel. Because that's when you start to get into trouble. And at that point, if we can nip it in the bud then, because you're having an honest conversation with your prescriber or with your pharmacist, for that matter, it's much easier to deal with it early on, and it's much more difficult and a harder road to deal with later on.
There's been legislation passed in the past years or months in regards to opioids, and we as pharmacists and prescribers and such have certain parameters or criteria that we have to do when we filling these prescriptions. Can you discuss that just slightly of what we as pharmacists are required to do?
Sure.
As such.
So when we receive a prescription, whether it's an opioid or really anything for that matter, we need to make sure that it's being used for a legitimate medical purpose. So there needs to be a reason that you're getting the prescription. There needs to be a doctor-patient relationship, and it needs to be within the scope of that doctor or prescriber's field of practice. So when I get a controlled substance prescription, I'm checking to make sure that it doesn't interfere with anything else you might be taking in your medication profile. There's a lot of concern over use of benzodiazepines like lorazepam or diazepam in combination with opioid prescriptions like oxycodone because it further suppresses the breathing center of the brain and can lead to overdose. So I'm looking for that. I'm also, so prescribers, anytime they write for a C2, Schedule 2 medication, so the oxycodone, the fentanyl, things like that, they have to check the Massachusetts Prescription Awareness Tool, which is a prescription monitoring program. So as a pharmacist, every prescription that I fill for a controlled substance gets reported to the state. And the state compiles that information in a database that pharmacists and prescribers have access to. So the prescriber is checking it when they're writing that prescription, and then when I get the prescription, I'm also checking it to make sure that there aren't any causes for concern.
And I gotta give it to our state because that system is absolutely amazing. I mean,
they did a great job.
It's been going on for many years.
Yes, it has.
But this new program that was started probably a year and a half ago or so is amazing. The stuff is up to date. And we as pharmacists and as our clinicians, our partners are able to check that data real quick. So
it's much easier to use.
Kudos to the state for such a great program, and I know it's being spread around the country. So that's one aspect that we as providers could provide maybe help in this crisis. You mentioned naloxone, which is also known as Narcan. That's all over the news. Can you discuss that? And what is it, and why we use it, and what role it has in this opioid crisis that we have?
So Narcan is an opioid antagonist. So basically what that means is it knocks the opioid off the receptor and it prevents it from having its action. So it basically, if someone is actively overdosing, signs of overdose are depressed breathing, so they have very shallow breaths. They sound kind of wheezy or rattly. They seem like they're struggling to breathe. They're not taking very many breaths per minute. They might be turning a little bit blue on the lips and around the face. That means that they're experiencing an overdose. And at that point, you would want to reach for your Narcan and administer it. And the Narcan basically stops the opioid from having its action. So it reverses the respiratory depression that causes the overdose. And it also precipitates withdrawal. So when you do administer it, the person is going to come to, and they're no longer going to have the opioid sort of in their system, so they're going to be a little bit uncomfortable.
Sure. And how would you administer that?
So there are a couple of different ways. You can administer it via intramuscular injection, or you can administer it nasally. So there are a couple of different products that are available. There's nasal Narcan, which is it's made in a nasal inhaler, and basically you squirt the entire contents of one unit into the patient's nostril. The other is a Lure-Lock syringe that you need to attach a nasal atomizer device to. And if you're getting this from the pharmacy or from any of the community action coalitions that are distributing these, they'll teach you how to do it. You twist it on, you spray the contents of the syringe into half of it into one nostril and the other half into the other.
And this drug has saved
countless.
I mean, it probably is not a number yet that we could look, but
countless,
probably thousands, if not more, individuals. So it's an important product to have. The issue is that we have the product, but we want to, as you said, nip the crisis in the bud is more important. We do have again, this drug has to be administered within certain parameters, otherwise it won't work. But it has done an amazing job, locally and in our town, and I'm sure your town, the police have used it, and EMTs have used it, and saved lives. So it's an important product to have on hand. Finally, what can parents do to keep their kids from experimenting with drugs, prescription or otherwise? So
you need to set a good example for your children. So when they have, and this starts at a young age. So when they see you drinking alcohol or taking medications, you need to be doing so in a responsible manner. And you should be having conversations with them about what the family expectations are about drug use, that it's dangerous. You should be having honest conversations with them and listen to what they're telling you. And then also provide them with ways to say no and role play. And I know that sounds kind of corny and silly.
Absolutely, but it's important.
I've gone through a lot of de-escalation trainings with the issue that I had with the robbery and other things. And one of the things that comes out of every training that I've done is make sure that you are prepared for whatever situation you are placed in. And so if you want your kids to be able to say no, they need to be able to practice that ahead of time, because they're going to be in social situations where it's going to be difficult to say no. And so the more strategies you provide them with and the earlier you do it, the better.
Karen, thank you so much for being here. It's an honor. With so much in the media lately about addiction to prescription drugs, many people may feel confused and concerned about how to prevent becoming addicted to medications, which is why we are so pleased that Karen, my colleague pharmacist at Inman Pharmacy, could join us today. Thank you so much again, Karen, for taking the time to speak with us, and thank you for tuning in to A Healthier You. For health-related topics and more information, you can find us on Facebook. I'm Saad Dino, co-owner of Acton Pharmacy, West Concord Pharmacy, and Keys Drug. And I look forward to seeing you around town. Be well.